adult male of unknown age, because we'll be polite. Adult male fell down, unknown man down as generally how this come in, or a fall. So we have a fall. Good enough. So from the doorway, we would start off with our assessment. We'd say, I see one patient. I have my scene is safe, or my scene appears safe. We would ask the proctor, is the scene safe? They would say, most likely yes, otherwise it's a very short scenario. I would show that I have my gloves on, or I would put some gloves on, somehow identify that I have my appropriate PPE is donned. So my glasses, my gown, my gloves, my boots, my vest, whatever it is that makes sense for the scenario you're in. So I have my PPE, my PSI, my scene is safe. So those are kind of the crucial 3 for starting off everything. Then I have one patient. I do not identify any major life-threatening bleeding. I don't see a need for any additional ALS resource, or I'm sorry, EMS resources to come. If ALS was continuing, we could continue them. We have looks like a fall. There's a table that's with a knocked over chair laying next to him here, so it makes sense. And now I can come off of my doorway here, close the door behind me, and then off we go. So I'm gonna walk up. The first thing I'm gonna do when I approach Ryan is I'm not gonna interact with him yet. I'm not gonna talk to him yet. I'm just gonna walk up and grab C-spine. So I'm gonna say, sir, can you hear me?
Yep.
What happened here today?
I fall.
You fell?
Fall.
Do you remember falling?
Yep.
Did you black out at all, lose consciousness?
I saw some stars.
Okay, does anything hurt right now?
Yep.
Okay, what's that?
My hip.
Your hip, okay, good enough. So at this point, I'm gonna turn C-spine over to my partner. So we would do the C-spine process for that. I'm gonna stand back up, I'm gonna look at the proctor, I'm gonna say some things. Now this is my time to get some points. So right off the bat, I say my patient is alert and oriented, remembers the fall, knows where he's at, is able to report some pain. We do have pain in the hip, we'll note that for now, we'll come back to it. He has good skin color. Again, there's no sign of any major hemorrhage, so we don't have to worry about any kind of major bleeding externally at this time. He's breathing, he's speaking in sentences, he's making sense, his breathing is adequate. I don't see any need to add an adjunct at this time. I'm not going to add any oxygen right now. I totally could have wanted some points, but I'm not going to at this point. I don't see any reason to address any of those things right now. Step back into my patient care scenario here. This would be a great time to reach down and grab a wrist, check for a pulse. The pulse feels fantastic. I'm gonna check the back of his neck for some C-spine injuries here. We have no step off, we have no deformity here. The back of the C-spine feels good. Does that hurt anywhere I'm touching you here, sir?
Nope.
We have no point tenderness as well. I'm going to identify the jugular vein. There is no distension, the neck veins are flat. We'll check for trachea deviation. Trachea is midline here. Continue right from there. Sternum is stable. Put my hands on the rib cage here. Sir, take a deep breath for me here. We have equal rise and fall of the chest, and the chest wall is stable. Any of that hurt when I'm touching you here?
No.
Abdomen, right there?
Oh,
Okay,
yeah.
is that the hip there?
Yep.
Okay, so abdomen is soft and non-tender in 4 quadrants. Come down here and check the pelvis here. Now his hip is sore, and we know the hip isn't a real hip thing. The hip is the top of the femur, but the pelvis is what we're looking for here. So we find the pelvis, identify the iliac crest, squeeze in on the pelvis. The pelvis is stable, but we are tender with a little bit of pain in the right hip area. We'll come back to that. Because that's the part that hurts, we'll start off over here. I'm gonna check the femur, nothing there, a little bit of lateral loading there. That is stable. Now, because he threw the hip into it, because I'm a smartass and got myself jammed up here, I really shouldn't do that thing to this leg. So right now we're going to assess for instability in the femur here. I'm not going to, because he has a hip problem here, I'm not gonna load this one. That's the knees, that's the nose. We started there, we ended here. That's the nose to knees assessment. And that would include this part of the assessment.